Thank you, Mr. Chair. Thank you, Doctor. In a news report on January 7, just a month or so ago, Secretary Kennedy stated, quote, "There is no evidence that the flu vaccine prevents serious disease or that it prevents hospitalization or deaths in children." Do you agree with that statement?
Senator Kaine, as I've said, I believe vaccines save lives and are an important part of our.
But I'm not asking about the general. I heard that testimony earlier, but the statement is there is no evidence that the flu vaccine, and I want to be scrupulous about this, prevents serious disease or that it prevents hospitalization or death in children. You're an MD, your qualifications have been much discussed earlier. Do you agree with the statement that there's no evidence that the flu vaccine prevents serious disease or that it prevents hospitalizations or death in children?
I have not personally seen that quote or that article. I would
Let's
want to review it before I comment on that.
Okay, I'm gonna set the quote aside. I'll introduce for the record an article, CBS News, RFK Jr. says it may be better if fewer children receive the flu vaccine, dated January 7, 2026.
Without objection.
Let me set aside the quote and set aside Secretary Kennedy and set aside the article. Do you believe that there is evidence that the flu vaccine prevents serious disease and prevents hospitalization or deaths in children?
I believe that all patients should talk to their doctors.
And so do I, and that's not what I'm asking you. Your qualifications have been much discussed. There is a mountain of evidence about this. Do you believe that there's no evidence that the flu vaccine has efficacy in reducing serious injury or hospitalization? This is an easy one, doctor. This is an easy one.
I support the CDC's guidance on the flu vaccine, and I will always be working with the CDC, ACIP, and the agencies.
So you believe it is an efficacious vaccine to reduce hospitalization? And
is or is not?
You believe it is?
As I said, I support the CDC's guidance on the flu vaccine.
Let me just say, do you think the flu vaccine reduces the risk of hospitalization or serious injury?
I've said
You're
it.
a doctor.
I believe vaccines save lives. I
The
believe they're an
flu
important part
vaccine.
of public health strategy.
The flu vaccine, does it reduce the risk of injury or hospitalization?
At the population level, I certainly think that it does.
Let me introduce for the record, if I can, Mr. Chair, CDC seasonal flu vaccine effectiveness studies dated May 30, 2025 from the CDC that goes into this in some detail.
Without objection.
This is not a hard question.
I answered your question.
I know it.
At a population level, I think it does.
You did.
Yes.
3 minutes in, you answered a question that has a very simple yes, or it had a very simple no to the proposition stated by the Secretary that there is no evidence. The Secretary said there is no evidence that this is effective. And yes, after 3 minutes, you acknowledge that at a population level,
I haven't seen that report. I have not seen
Yeah, but you know about the flu vaccine.
If I had a nickel for every time I was misquoted in the media, I'd be a very wealthy woman. I would like to understand what his comments were.
I'm not asking you about the quote. I'm asking you about something in your remit, the effectiveness of the flu vaccine. All right, let me ask you this. Do you believe it's important to continue to work to reduce youth smoking?
Certainly.
President Trump has said it's a priority to support moms, including supporting families that may need IVF. Do you support that position?
I know the administration is strongly in favor of IVF, and I think people should have access to the best quality fertility treatments. And also my core message has been about how we are missing the mark on our fertility conversation.
I just was asking about IVF.
Yeah,
and
certainly.
Finally, the Secretary and the President have talked about radical transparency in healthcare. You believe in that?
Yes.
Okay, then I'm very puzzled, not by you, but I'm puzzled about why the administration eliminated the CDC Office on Smoking and Health. It was the only federal entity running the campaign to promote smoking cessation. They eliminated it. They've eliminated whole programs at the CDC working on maternal health, including the center tasked with publishing data on the effectiveness of IVF clinics. They've eliminated the CDC's Freedom of Information Act office. They've repealed the Richardson waiver, thus reducing public participation in the creation of HHS rules. I'm glad that you support smoking cessation. I'm glad you support work on IVF. I'm glad you support radical transparency. I'm puzzled by why the administration doesn't. I yield back.